My name is Dr. Thomas Spitzer. I'm in the Hematology Oncology Division at the Massachusetts General Hospital. I'm Director Emeritus of the Bone Marrow Transplant Program here. You asked me why I chose this field of specialization. It's kind of a long story. I didn't actually start out in hematology oncology. I started out in general internal medicine. But my experiences during residency of taking care of patients who had serious illnesses for which we were sometimes successful in treating, and the relationships I had established with those patients and their families over the long run was a magnet for me, drew me back into the field. So I went back and did a fellowship training in hematology oncology. It so happened that one of my medical school classmates, who had gone straight through the training, was then Associate Director of the Bone Marrow Transplant Program. So he was a friend, a medical school colleague, but he was also a mentor, introduced me to the field of stem cell transplantation. And it was that field that combined so many things that I loved in medicine. There was certainly a lot of applied internal medicine. There was the interest in certain diseases like the leukemias, and what I was seeing unfold even way back then in terms of new treatments, the potential cure of stem cell transplantation. So over the 40 years in that field, I have seen just amazing advances in the field of stem cell transplantation in terms of the curative potential for diseases. When I started out in my training, there weren't curative treatments and such, so it's just been a wonderful, rewarding experience over 40 years.
A lot of people ask me why I chose hematology, but I actually think that hematology chose me. So unfortunately in Ukraine we don't really have very good educational program for hematology specialization, but I was fortunate enough in my life, and I was for 6 months studying in Romania, and they had hematology classes which we don't have in Ukraine. So I just fell in love and I realized that I want to do that. And when I came back, I had a really long way to become the hematologist, because after I graduated from the university, COVID started and we didn't have any practice with the patients. Unfortunately, only theoretical part. And then, so I was trying to find a way how to have some practice. And I reached to one professor from Kiev, and he was very kind, and he bring me into his department. And then I had this practice, and I just realized that, yes, this is what I want to do.
So you asked me why I volunteered to work with Dr. Kostenchak-Sifstak when I am as busy as I am, which is true, but I've always felt the need to give back to others who have helped me where I have come in my career. When it comes to Ukraine, there was a special need on my part to give back in some way I can. I know Dr. Kostenchak-Sifstak wanted to bring bone marrow transplantation to her hospital in Ukraine, and I felt that it was the least that I could do to train her during the month that she was here, and to have the knowledge she needed to take back to Ukraine, and to help the people in her country offer treatments that we're offering here that are potentially curative for the diseases that she treats in the field of hematology.
After the Kiev, I went back to my hometown and started to work as a hematologist just 1 month before the war started. So, of course, first months were very hectic. We were very short on treatment, on evaluation patients, and it was very difficult. But then we realized that we need to fight in our own battle with our patients. And so personally, I was trying to look for different programs to help other patients. And I was searching that just on the internet, and I found this organization, GMKA, And I texted to the founder, Nelia Melnichuk, and that's how I was involved since then. And my part there is to write patient articles, to give patient information about their disease, how to fight it, how to be cool with the side effects, what to worry about, what not to worry about. And it's a very important part because I'm still working with my patients, and I realized how it's important for them to know all the information about their disease. Not just a couple of things, couple of questions that they can ask the doctor, but far beyond that. And so then I was chosen, and Dr. Poznansky assigned me to Dr. Spitzer. And you know what? He is a founder. He was the first to start bone marrow transplantation program here. Could you imagine how fortunate I am? And it was really amazing. Dr. Spitzer is a very clever, very passionate doctor. He really cares about his patients. And here they have very unique program. They're doing bone marrow transplantation simultaneously with kidney transplantation. It's just something amazing that I could only read about, and now I had a chance to see that. And then Dr. Spitzer showed me laboratory where I see how the blood products are being collected, stored, and processed. And you know, we have similar technology in Ukraine, but it's like an old car and a new shiny car.
I was struck immediately by how much hematology she knew. And this impressed me so much because she was practicing in an environment where she didn't have the resources that we have here. I was struck by her passion for patient care, for bringing bone marrow transplantation back to her hospital. She is incredibly humble. She is an avid learner. She asked many questions. So in 1 month's period of time, I can't remember anyone absorbing as much knowledge as she did, and showing the kind of determination it takes to build a bone marrow transplant program and introduce to her hospital some of the most modern treatments for leukemias and other types of blood cancer.
What I dream about, what I observed here, and I would really like to bring back to Ukraine, is the whole patient care process. So it's all not only about the treatment, it's all about support, like social workers, physical therapists, a lot of nurses. It's all help the patient to keep fighting and to live longer. And I wish we will have that one day in Ukraine.
I have every confidence that she will succeed in bringing bone marrow transplantation and bringing the best available modern therapies to her hospital and her country. And if we succeeded in even a small way in teaching her about transplant and new novel therapies in the field, then we all feel like we've accomplished a great deal. You were wondering if Dr. Kostenchak-Sifstak and I have kept in touch, and the answer is yes. Communication, despite the barriers of war and other obstacles, is quite easy through WhatsApp. We've been able to communicate. I learned that Olha made it home safely and that she's busier than ever, that they must have left a lot of work for her when she got back. I told Olha before she left to always feel free to reach out by whatever means. If I can ever help her in her training or in discussion about cases and things, I told her that I'd be more than happy to be available to her.
I would like to say something to Dr. Spitzer. You're the best mentor I ever had in my life. You're the great teacher. You're the great doctor. You teach me a lot, and I will never forget you.